Hey everybody, and welcome back to Great Academy's Home Economics lecture. We're continuing with Core 1 and our Chapter 2. As you remember, the last day we looked at energy and BMR and the role that energy plays in the body. So today we're going to be moving on to look at the specific dietary requirements that we have. So there's a number of groups there that we're going to look at. Now, we will be going through them, but obviously you will need to have menus attached to each of those. So we will get to that towards the end of the lecture. So first and foremost, we have pregnant and breastfeeding women, babies, children, adolescents, adults, the elderly, and convalescent. If somebody is convalescing, that's somebody who's recovering from an illness or surgery, and basically they're recovering from that illness. So that's what a convalescent actually means, but we'll come back to that again later. So we start off with pregnant and breastfeeding women. During pregnancy, a healthy, well-balanced diet is essential for the formation of the new cells and tissues in the fetus and the mother. It also reduces the risk of miscarriage, stillbirth, or other birth abnormalities. So breastfeeding women then should follow the same nutritional guidelines below, but should also increase their fluid intake. So you will see here we have all our nutrients that we spoke about in chapter 1, and you will notice again here that some of them aren't listed there because these are the ones that are seen as vital during the breastfeeding and the pregnancy stage. So first of all, up there you have folate and folic acid, and you'll remember that from our vitamin section in chapter 1. One of the main functions of folic acid in pregnant women is that it reduces the risk of neural tube defects and such as spina bifida. It's protein synthesis, production of new cells, and it's essential for red blood cells. So where will you find it? In fortified cereals, oranges, eggs, and wheat germ. And in pregnant women, they should be taking a supplement of folic acid prior to conception and then for 12 weeks afterwards as well. So that's really important. Then we go through protein and calcium, vitamin D, iron, vitamin C, dietary fiber, and fatty acids. And some of them have specific functions, obviously, because it is a pregnancy. Protein for new cells and tissues, vitamin D, the absorption of calcium for your bones and your teeth, iron for the healthy blood cells, but also to prevent anemia in the mother and also in the baby. Dietary fiber for preventing constipation. Constipation can be an issue when you're pregnant. So they're the nutritional requirements. Now, a pregnant woman should avoid salt as it can cause high blood pressure or edema, and which is water retention. And water retention can be a particular issue for pregnant women, particularly later in pregnancy when they would be maybe larger. Avoid alcohol as it can cause fetal alcohol syndrome. That's where the baby itself has issues when it's actually born, low birth rate, etc. Smoking as it causes a reduction in body weight of the baby, raw eggs, unpasteurized cheese, and pate, as there is a possible source of food poisoning through salmonella and listeria bacteria. And an infection like this could increase the risk of miscarriage, particularly during the early stages of pregnancy during the first trimester. So then we move on and we look at babies and what do babies need. So during the first 6 months of a baby's life, they grow rapidly. And you can see that when you look at a newborn baby and then when you look at a 6-month-old baby and just the difference between them. So babies have two options. They can be bottle fed with a dried formula milk, such as something like SMA, or they can be breastfed with breast milk. Both will contain the necessary nutrients, and we will have a quick look at breastfeeding there as to what the benefits of that are, because it helps the bonding between the mother and child. Breast milk is sterile and it's always at the correct temperature, and it contains the antibodies which can help fight infection. Breast milk also contains less fat than formula milk. Then as the baby moves on, the baby at 6 months will start to have solid food introduced, and that stage is known as weaning. And we need also to make sure that our baby is getting enough iron and vitamin C at this stage. The weaning stage can start sometimes around the age of 4 months, but normally between 4 and 6 months. And the food that the baby will be given will be pureed, it will be semi-solid, to allow the child to actually be able to eat it. Because remember, the baby at this stage won't have any teeth. So therefore, they won't be able to have physical digestion at that stage. Avoid sugar and salt in the diet for the baby. and you gradually introduce all food groups to the baby's diet. Fresh homemade food with no additives are the best nutrition for the baby, and that can be easily done by bulk baking the potatoes, the carrots, or whatever food you're giving them, and actually freezing them. And that makes it very convenient for working parents. Then if we move on and we look at children again we know are growing rapidly, and we look at a 1 year old and then we look at a 5 year old and what happens in those intervening years. So balanced diet, all the necessary nutrients are necessary for growth. Children can become fatty or fussy eaters at this particular stage. So that's why it's really important from a young age that they're introduced to a wide variety of food and that their palate is allowed to develop that way. So again, you see nutrients here that we've spoken about before. You know the function of these nutrients. Why are they particularly important for children? As you're filling out your worksheet, you'll be able to identify that. Obviously, bone and teeth formation are really important for young children, as is protein for growth, vitamin D for the absorption of calcium, and also we look at now as vitamin D being a supplement because we often get vitamin D as well from the sun, and sometimes we don't get sufficient amount of sunlight. Iron, and then vitamin C. So again, knowing your food, knowing the source, knowing what it does in the body is really important for children. Again, with children, avoid sugar. That can create a sweet tooth and it results in tooth decay. Avoid salt, again, can risk high blood pressure. Present food attractively and avoid using desserts or chocolates as treats or rewards. And if we think back to our earlier section on the energy and the food pyramid, we saw that at the top of that was our sugar and our treats, and that was like 1 to 2 times a week maximum. Limit the amount of fat and fast food that's in the diet. While it can be convenient, sometimes it does lead to unhealthy diets for children. And current research has identified fat and sugar as the main nutrients in a child's diet. And this imbalance has increased the number of children suffering from obesity to 1 in 4 children. So 1 in 4 children in Ireland at the moment are overweight or obese. And that would be the most up-to-date information that we have from the Healthy Ireland survey in 2015. As we move on to adolescence, then adolescence again is another growth spurt. Going from childhood to adulthood, you're transitioning, you're a teenager, you're going between that child to that adult, and a balanced diet is really, really important again here. Again, we see our nutrients. Why do we need them? You see there with protein now, hormone production. Obviously, that's really important during the teenage years because of puberty. Again, fiber prevents constipation and bowel disorders using brown bread, wholemeal pasta, etc. Calcium is really important at this stage for young people to help bones and teeth and prevent osteoporosis later in life, because often a lot of what you will take in calcium is laid down in your bones at this stage. Helps absorb calcium. We need vitamin D, so very important. Iron again prevents anemia, especially for young girls, especially during menstruation. And that's why sometimes you get teenage girls can become anemic. So having sufficient iron in your diet is really important. Then we also need vitamin C. If we don't have vitamin C, we don't absorb the iron, and that can cause issues as well. And you'll remember that from our chapter 1 when we looked at iron and vitamin C. So some eating disorders that can be common to adolescents. It doesn't mean they're exclusive to adolescents. Adults also can suffer from them, but we will look at them in the context of adolescence at the moment. Obesity, anorexia nervosa, and bulimia. And obesity we will look at in the next lecture. So for this one, we will look at anorexia and bulimia. So when we look at what is an eating disorder, it's a serious disruption to a person's eating habits or appetite, which may reflect abnormal psychological behavior. Anorexia nervosa and bulimia nervosa are both psychological disorders where the person fears becoming fat or obese. Their image of themselves is distorted and unreal. So while it manifests itself physically, it's actually a psychological disorder. So if we look here at anorexia nervosa, and bodywise.ie is an excellent website that's available in Ireland for information and support. So, if any concerns about any eating disorders like that, it's a really good website to look at. So it's restriction of food intake. So there's an intense fear of putting on weight, and therefore there's a preoccupation then with body weight, size and shape. Self-evaluation and self-esteem become increasingly linked to these. Perception of your body shape and size are disturbed. Your body image distortion, like we mentioned already. Disruption of your hormonal balance, which can interrupt your menstrual cycle. Periods can become irregular and even cease. And in men, it can lead to a loss of libido. In pre-puberty children, growth can be disrupted and sexual development can be delayed, because we have had instances of children as young as 6 and 7 actually suffering from anorexia. So when we look at the symptoms, so we have weight loss, being cold with poor, bad circulation, often bloating of stomach because that's due to the fluid retention, constipation, abdominal pain, restlessness, inability to settle, loss of periods, decreased interest in sex, difficulty sleeping, dry and thinning hair, dry, discolored skin, growth of fine downy hair. And that can be if you look back to being cold, that's also trying to keep the body warm. That's the body sort of defense mechanism to keep the body warm at that stage. Again, the loss of periods that we've mentioned, decreased interest in sex, again, and marked change in the person's actual behavior. So low self-esteem and mood swings, etc. Then if we move on again to bulimia nervosa, and again, Bodywise is a great website to go to for this information. And sometimes with bulimia, the person is normally near normal body weight, so sometimes you don't actually notice that. Whereas with anorexia, often there can be a huge weight loss. Bulimia and nervosa can result in intense hunger, often the huge periods of eating, and then they vomit to compensate for overeating, or they use laxatives. The periods can stop if the weight loss is extreme. They binge eat, so they eat larger than normal quantities of food in a very short space of time. And then there's a guilt complex with that, where then they end up vomiting or using laxatives. Other means of trying to ensure there's no weight gain include periods of starvation or dieting, exercising, and using diuretics. They again have a preoccupation with their body weight, size, and shape. So there are three different ways in which the symptoms, I suppose, can materialize, and they're the physical one, first of all, such as tooth decay, which is the acid from the stomach. You have the inflammation of the food pipe, which is the esophagus, because when you've been inducing the vomiting, you have the acid from the stomach coming up through the esophagus. Your teeth also will be affected, and your gums and swollen salivary glands. Dehydration due to vomiting. Then you have some psychological depression, feeling out of control, and then other behaviors can be abuse of laxatives in order to control the weight. And then there's risk taking behaviors such as alcohol and drug abuse. When we move on now to look at the adults, so as you're going through your worksheet, you'll see there's a common theme really with regard to all of these. We're looking at the nutrients that are necessary to be healthy at this particular time in your life. So one of the key things here is both gender and age will influence the kilocalorie requirements, and we know that from our previous section on chapter 2. So with adults, again, you're seeing nutrients that you're familiar with, the protein, carbohydrates, the fiber, the fats. One of the things here with fats is that it's unsaturated, because you can have a risk of cholesterol buildup in adults, and you want to reduce the risk of the cholesterol building up, because that can then in turn cause coronary heart disease. So that's a really important one there. Iron, again, preventing anemia, especially in women. And again, meat and dark leaf greeny veg can do that. And again, calcium for your bones and your teeth. And you have vitamin D and vitamin B. So you can see there's a wide variety of nutrients there. And the reason why you actually have to have them at this particular stage in your life. It's also recommended to reduce your salt intake to prevent hypertension, which is high blood pressure, again, which adults can suffer from. Limit your alcohol intake, and to give up smoking. So these are all in relation. They would be supposed lifestyle. Sometimes when you're asked this question in the exam regarding any of these particular groups, they can refer to dietary and lifestyle recommendations. So it's really important when you answer that question that you actually refer to both diet and lifestyle. So your diet would be your nutrition, your nutrients, your food, whereas your lifestyle would be, limiting your alcohol intake, increasing your physical exercise, giving up smoking, etc. So please be mindful of that when you're doing your revision. Our next group then are the elderly. And again, the elderly, I suppose, are often sometimes less active than they normally would be. And that can often be because they've retired, maybe they're not at work and things like that. But often elderly people can be very, very active, and their diet also needs to reflect that if it's so. Elderly people can have a reduced income, so have to become more economical when shopping. And also, they might be shopping for less people. They might have been used to shopping for four or five in a household. Now they might be shopping for one or two. They may have a physical disability such as arthritis, which would make them less mobile and agile to cook or to shop. So therefore, it's important that they get the support that's needed at home, and there are various gadgets available that can really help with the physical aspect of cooking and being able to chop vegetables, turn on the taps, etc. Malnutrition is a common problem among the elderly, as often they live alone and won't cook healthy meals. And this obviously can have a huge impact on their overall mental health and well-being as well. And so things like Meals on Wheels, which is a charity which goes around and provides healthy meals, balanced meals to the elderly in a locality, is a huge resource. When we look at the list of nutrients here again, you will see that we're having, repetition here with our protein, our calcium, all of our vitamins, our iron, our fiber, and our water, and then where you will get them. So how do you know what foods, provide what nutrients? Often you can remember that and learn that actually through just your everyday eating and, looking at labels to see, oh, what's in this product, what's in that product. So you become familiar with it because you will see you'll be repeating some of that in your exam itself. Again, you continue to omit fat, sugar, and salt in the diet. I mean, that's for all age groups, and you'll have seen that throughout this presentation. The risk of coronary heart disease, diabetes mellitus, and high blood pressure. Now, we will look at those in the next lecture, which is part 3 of this particular chapter, and then also to avoid spicy food because the digestion of it, as you get older, can be more difficult. And the convalescent, then, as we said already, the convalescent is somebody recovering from an illness, and a person can be convalescing at any age, and therefore their diet needs to reflect that. So when we look at the diet, you will see again the nutrients that we would have with regard to our other food groups, but you can also see here that there's reduced activity, so reducing your calorie intake. Again, no spicy foods. High fiber foods would be important. Easy to digest foods. Often protein foods are really easy to digest. If you think of things like eggs, scrambled eggs, poached fish, milk, they're all nutritious, providing protein, providing calcium with the milk, but like yogurts even. But again, they're easy to digest, particularly if you're recovering from surgery. Increased protein for repair of cells and to help the healing process. And again, we will look at eggs later on in the next section, and you will see how much protein they provide. So you can see why maybe those easy to digest foods are given to people who are convalescing. Increasing your water intake to prevent dehydration, and that applies for everybody. And obviously, strict hygiene guidelines during food storage, preparation, cooking, and serving in order to prevent infection of the person who is convalescing, which could be detrimental to their health if there was an issue with food poisoning. So again, we're back to looking at our exam analysis. And again, we will look at all of these together because you will find that there are different elements that come up for each particular food that we've looked at here, and also each different set of people who are babies, pregnant, nursing mothers, children, adolescents, the elderly, people who are convalescing. Okay, so get your worksheet done. I wouldn't be advising you to move on to the next lecture or part 3 of this chapter until you've done your worksheet, really, because the information that you have here and that you will learn here will be really useful for you in the next lecture. Okay, so again, thank you for watching our Great Academy Home Economics lecture, and until I see you the next time, happy learning, guys. Bye.